Hip abductor exercises are very important for numerous disorders. Weakness of the hip abductors is associated with low back pain, hip disorders, as well as a predisposition to damage to the anterior cruciate ligament. The process of dynamic valgus is facilitated by weakness of the hip abductor muscles. I want patients to be working on these regularly. We have got on the website the sideline hip abductor series, but these standing exercises are more demanding and more functional. It would be appropriate for people to obtain the ability to do these standing hip abductor exercises. Erin will start by showing us the skater position, and she has the choice of two different types of tubes. Both are commercially available. The rubberized tubes tend to break easily, and I discourage them. The type of band called a slingshot is very durable and lasts for years. Putting the slingshot on requires some coordination in and of itself, so sometimes this would be done in a seated position. The slingshot is taken up to the thighs because putting it too low makes it too difficult. It rides on the lower third of the thigh, and then we can perform different exercises, strengthening both the hip abductors, the thigh musculature, as well as the anterior and posterior trunk musculature. Again, the abdominal muscles are braced, and then Erin will first show us the skater exercise. She maintains all of her weight on the left thigh, trying to prevent the knee from going into dynamic valgus. She is here working mostly the weight-bearing thigh muscles through the hip abductors. Performing 3 or 4 sets of 10 of these exercises are an excellent stress to the hip abductor muscles. The speed skater can then be changed to a simple sidestep position where an individual shuffles their legs, again, emphasizing an athletic position, bracing of the abdominal muscles, and then simple abduction of the hip. Both the standing and the moving hip abductors are firing in this very functional exercise. Another commonly described exercise is the monster walk. In the monster walk, both of the hip abductors are activated in an athletic stance, and short steps are taken to activate balance, stability, as well as the hip abductor musculature all the way down through the kinetic chain. By slowly internally rotating the toes so they point at each other, the gluteus muscles fire in an even more intense fashion. These are very functional exercises to strengthen the hip abductors.